Our first presenter is Wendy Warrington, and she is the Chief Operating Officer for a company called SoberGrid.
Hi there, I'm Wendy Warrington, and I'm delighted to be here this evening. Thank you, AngelMD, for this opportunity. So SoberGrid was founded to better address the gaps in the continuum of care for millions of adults with substance use disorder. There is a marked discrepancy between the number of people who need addiction treatment in the United States and those who actually receive it. Stigma, cost, and accessibility contribute to these barriers. We address these barriers by creating an affordable solution with built-in anonymity, supporting all pathways to recovery and providing 24/7 access to support and resources. And for those who do seek treatment, many will relapse. And we created a solution that helps mitigate relapse by allowing an individual to connect to a sober network, get support when they need it, track mood, monitor progress. And this helps with accountability and resilience. So as I mentioned, about not only few receive treatment, but also few treatment programs integrate peer coaching and peer support. And so in peer support and peer coaching does not replace the need for formal treatment, but it does provide a unique and different perspective because they have lived experience. And so our peer coaching solutions provides that 24/7 access with these increased resources and support for individuals, and that many other solutions just aren't able to offer. And so our solution actually has two components. The app itself, which is available in the Google Play and the Apple Store, is free. And it gives individuals access to a large recovery community of over 300,000 members. And they can get support from that community, practice daily sobriety habits, and as well as monitor their progress. But not only can people get support, but they can give support, which is an important aspect of someone's recovery journey. And the app and the recovery community concept benefits everyone, regardless of what stage they are in their recovery. But for clients who need maybe additional levels of service, we offer a premium model. And this includes cognitive behavioral therapy, a resource library, our coaching, as well as crisis support. And if you think in terms of our premium model, our programs really serves as an adjunct to treatment, and we can support different phases of treatment. And really where we fit in is that we can provide support for every aspect of the recovery journey. We're also able to provide adjunct social work services to areas where there's less support, such as aftercare and long-term follow-up services. Individuals can access our premium services through our contracts with state agencies, treatment centers, employers, or through our monthly consumer subscription model. Works is we address these gaps really through the coach and accessing an individual. We assess the individual's risk and need for support. Our coaches are state certified and trained, and they work with individuals in supporting progress toward their custom recovery plan by providing accountability and resources. We've someone maybe who would be considered on maybe low level of support may just need the community and maybe the digital resource library. For the next level, it could be a CBT, structured or more frequent peer coaching. And then at a very high level support, this is where we offer the crisis support, and our coaches are trained to be able to hand that over to a healthcare professional if necessary. And the road to recovery just is not linear. And so individuals can easily dial up or dial down in the support that they need. And we collaborate with our premium clients really to identify goals, address the needs, fill in the gaps around engagement, as well as provide custom reporting. This is an example of our coaching program and its effectiveness. There was a study by Wright State University for the state of Ohio, and 470 of our patients participated. The bars in black was an intake, and the bars that are in red were at 6 months. The graph on the left shows that patients reported a reduction of substance use by 60%, and the graph on the right shows that patients reported improvements in mental health by 30%. At the top of this slide, I've included some notable awards, state agencies, collaborators, and strategic partners. Sections are color-coded under each of our time period. In blue, we have our company, products, and IP. Red is our strategy, and green is our revenue and funding sources. We launched our free social media app in 2015 and saw good growth. But our founders also recognized that there was need for additional specialized support. So in 2018, we acquired a peer coaching company called Ascent and put that on the platform. And what may surprise you is even in the early stages of our company, we've been focused on research and development. We've received federal grant funding primarily from the NIH and the NSF, with the opportunity to collaborate with researchers from UPenn and Virginia Tech. We've completed several phase 2 clinical trials, and we have a robust pipeline for future projects that include things like predictive analytics, virtual reality, a researcher portal. And this is all going to allow us to move into other disease states, such as pain management and PTSD. This has been a great source of non-diluted funding, while at the same time allowing us to develop technology and gain critical insights from leading addiction experts. We're really excited about our partnership with Orexo, a pharmaceutical company based in Sweden. We're a distributor of their digital therapeutic line with programs for opioid, alcohol mitigation, and depression. And this year we have a new opportunity with Walgreens launching next month. We've been approved to be their sole vendor for drug and alcohol addiction support on their Find Care website nationally. As mentioned, we have a strong B2B model for our premium services, and this opportunity with Walgreens is going to help us really expand our model. We're committed to gaining insights from our large recovery community, listening to our customer needs, and then leveraging technology and our platform in order to continue our mission to better address gaps in the continuum of care. We have a strong internal team of a talented team and an external group of advisors to help us monitor our mission and help us make advances in addiction science. And that concludes my overview of SoberGrid, and I look forward to answering any questions that you may have.
Great. Thank you so much, Wendy. I think everyone on this call understands what a big issue addiction is. And I think also the fact that this problem has only grown tremendously during the pandemic. So this is really exciting to see that there are solutions out there, not only the community aspect that is free, but then your premium services. Again, I want you to talk a little bit more about not only, I know you mentioned the services are affordable, so talk a little bit more about the cost of your services and who pays for those premium services. How do folks get into that pathway?
Sure, absolutely. So we have several options. One is working with employers, and we have a per member per month subscription model, as well as a model where state agencies can also purchase bundles to receive the services. And our services range between, depending on the level of services that they want, because everything is a bit of a menu item. So it ranges in price between $1,800 to about $4,000 per individual if you look at at the licensing bundling component of it. So it is very affordable. If you look at, it's about $6,000 to $36,000 for a 30-day treatment program. So when you look at this from an annual standpoint, it is a really good investment. State agencies, they have gotten a lot of their funding through the state opioid programming, the opioid funds, and then we anticipate additional funds coming through the American Rescue Plan Act. Individuals can also purchase our services through our consumer subscription model, and it's $99 a month.
And we do have a question from the audience, a couple related to some of the things that you just answered. What percentage of users opt for the premium services, the free aspect, and then opt for those higher level services on the subscription model? Can you talk about
Sure,
what
absolutely.
percentage?
Actually, that is a bit lower in terms of a percentage. Our main business model has been business to business, and so that is where the majority, I would say probably 75% of the people who engage in our services are coming through state agencies, employers, treatment providers, and then the other 25% is really coming from people who are on the app and then recognizing that they could benefit from our services.
Great. And another question related to your partnerships with state agencies. Dr. Warrington, who's our Chief Medical Officer, said you mentioned that you're state certified. Is this regulated at the state level? And if so, how do you manage that across state lines?
Right. So actually, when we talk about state agencies, we're talking about a lot of various agencies, everything from drug courts to prison reentry to participating with local county governments with their opioid programming. These are just examples. Our coaches are state certified, and what that means is that they have to have lived experience, and then they have to go through a certification process in the state in which they live. In order to be able to meet the criteria to be a peer coach, a peer recovery support coach. And so we certainly have our standards, which we have raised the bar in terms of expectation, but those are minimal, and most of them do require to maintain their certification every 2 years.
Great. And another question from a physician in our audience. And I really like this. It seems like right now you're focused really on drug and alcohol addiction. But there, as Dr. Zilberman says, there are all kinds of addiction, even to the internet. I mean, we could
Gaming,
right? Gambling, all that kind of stuff, right?
Mm-hmm.
How do you address these issues, or do you address? How do you address them if you do? And if not right now, are you planning to in the future?
It's a great question. What we have found is that has not been our focus, and that will probably necessarily not be our focus. We have found partners when we identify those opportunities where we're able to handle and hand over to them through healthcare professionals. So one example is a company called KindBridge, and they offer and they specialize in addictions, in gambling, gaming, you name it, and they provide that level of service.
Great. That I know you guys have a lot of partnerships out there, so and have the ability, or your peer coaches have the ability to make some of those referrals and recommendations because those resources are already kind of built into your program, which is fantastic. One additional question from our audience. Privacy would seem to be a big challenge, especially because you have this free sober community. Is it an issue, and how are you addressing it?
Well, I would say that part of the challenges with someone, especially, is around the stigma. And so when I talked about the built-in anonymity, someone can enter the platform and they can disclose as little or as much as they want. They can show their picture. They can create a username. When we're talking about some of the other services that we utilize, we typically use non-identifier information on our reporting. So that way we're able to give our clients the information that they need, but as well as then being able to make sure that that person does have the anonymity. And there are times, though, where we do require a release of information, especially on our higher risk clients, where we do need to be able to make those connections and make those have those conversations with their healthcare providers. So as much as we try to protect their anonymity and what they need, we also recognize that we need them to be a partner with us as we help them in their journey.
Great. Well, Wendy, thank you so much. I know we have a few questions, one maybe in the chat and another one in our Q&A that did not get answered, but I want to encourage everyone who's with us tonight to come talk to Wendy after the event and get those questions answered, because again, we're not going to have time for all of them, but we appreciate you being here. Thank you for telling us all about SoberGrid, and it's exciting to see again, a company, I think, really doing a great job attacking this very important issue. So thank you for being here.
Thank you. Thank you so much.